Good morning. Welcome, everyone. My name is Kathleen Helgeson, and I'm the coordinator of the Patient and Family Resource Center. It's my pleasure this morning to introduce Jodi Hyman, who is going to be presenting on immunotherapy, a new take on a tea party. Welcome, Jodi.
Good morning. Thank you, Kathleen. This is so exciting to be here this morning. I'd like to take the opportunity to welcome everybody to the first Living with Cancer, a Patient and Family Conference. I think this is a very exciting opportunity to be able to welcome everybody that is going through the cancer patient journey, as well as their family members and anyone else that's interested in joining in. So today I've been asked to talk about one of the types of treatment, and that treatment is known as immunotherapy. So I'm going to just share my screen and then we'll be able to go from there. So, a different kind of tea party. So for presenter disclosures, my name is Jodi Hyman, as Kathleen said, and I'm a nurse educator here at CancerCare Manitoba. My area of speciality is to help support the community oncology program, which are all of the 16 sites located around Manitoba, where people can receive their care closer to home, as well as helping out with some of the chemotherapy, immunotherapy, biotherapy, so basically, the treatments for cancer. I don't have any relationships or financial sponsors to disclose. So today, at the end of the session, I'm hoping that people will understand what immunotherapy is. So immunotherapy is actually a bit of a broad term, which I'll show you on the next slide. But I think what we're really talking about here is something called checkpoint inhibitors and how it helps control cancer. We want to be able to know how to identify potential side effects, when you should contact your cancer team, and what are the treatments for the potential side effects. So there's a big bit of confusion that goes around. So a lot of people just go by the old term, which is chemo, everything's chemotherapy, or everything is targeted therapy. There's a whole bunch of different umbrella terms that come into play when we're talking about all the different types of drugs that are able to work in treating cancer. So the most appropriate name would be something called systemic therapy. So what that would refer to is it refers to any medications or any drugs that work throughout the body. So these can be given via intravenous infusion, they can be given by injection, they can be oral pills, they basically are inside of you and they'll work throughout your whole body. This is different versus radiation, where we know radiation is specifically targeted to the area where the beams go, or surgery, where they're just basically operating on a specific part of your body. They can also be referred to as targeted therapy. So a lot of these names get thrown around altogether. So it's just important to know that often it is an umbrella term. You can see here I've put up biosimilars, checkpoint inhibitors, monoclonal antibodies, targeted therapies, drug conjugates, small molecules, biotherapy, chemotherapy. So the way that these work is all of these drugs are named in accordance to the way that they fight the cancer. So whether it be an immunotherapy or a chemotherapy, it goes under the title just in the way that it affects the cancer cell, just to sort of be clear. The other thing to note is one type of systemic therapy isn't stronger than the other type. So each of the different medications, whether it be a chemotherapy, an immunotherapy, a monoclonal antibody, a targeted therapy, they're all equally strong. What happens is they just have different side effect profiles. So that's something to keep in mind. The other thing is the pharmaceutical companies spend a lot of time and energy making things more convenient for patients. So if you were prescribed pills versus IV drip, then we know that the pills could be equally as strong and equally effective. The drug company has just spent a lot of time and energy making things more convenient for patients. So, what is immunotherapy? So, immunotherapy basically boosts the immune system and helps the immune system attack and fight cancer. It's able to stop or slow the growth of the cancer cells. It stops the cancer from spreading to other parts of your body, and it basically helps the immune system work better to destroy the cancer cells. Again, as I said, immunotherapy is somewhat of a broad term. It can be anything that, say, helps increase your white cells by affecting your immune system, increase your red cells to help carry the oxygen around your body. But for the most part, here, we're talking about, if we defined it a little bit more, something called a checkpoint inhibitor. So it's really very smart science. The scientists were able to find a whole bunch of markers outside on the cell surface that enabled the cancer cell to become invisible. So, what these checkpoint inhibitors do is they make the cancer cells visible to our immune system and specifically to our T cells. So, our T cells are a type of white blood cell and they're our attacker cells. So, they're the ones that are sort of fight or flight. They're the ones that recognize different viruses, different things that are foreign to our body, and they attack them. But what's happened is the cancer cell's able to make themselves invisible. So then it's off the T cell radar, and then the T cell isn't able to kill them. So this is just another slide in regards to what was. This is just another slide in regards to what I was saying. So cancer cells have checkpoints, that hence the name checkpoint inhibitor, on their cell surface, which play an important role in stopping our immune system from destroying them. What happens is this allows the cancers to grow. Cancer cells essentially become invisible to the T cells. So how does immunotherapy work? So basically, the immunotherapy, so again, that checkpoint inhibitor, there's 8 different types of checkpoint inhibitors that we have here in Canada. And basically, they all work in a similar fashion by binding to the checkpoint, which is the invisible serum. And then here, it turns that off. So the T cell or immune system is able to recognize the cancer and to kill it. And this is just an image demonstrating that. So they block the tumor cells from deactivating the T cells. Here, this is before we had the invention of the immunotherapy or checkpoint inhibitors. So they would go and they would basically turn off the T cell so it was unable to recognize the cancer. Now, with these drugs, or they call them inhibitors, it inhibits this point in which they're able to turn off the recognition of the cell. So it is a newer kid on the block. So a couple things to note about the immunotherapy or the checkpoint inhibitors is they're always given via intravenous infusion. So this type of drug is large proteins, so they actually work on the outside of the cell to allow that cell to be visible. These kinds of drugs are available at all of the 20 CancerCare Manitoba and community cancer program sites throughout Manitoba. There's no nausea or vomiting. There's no hair loss associated with these. There's currently 8 different drugs that are considered to be in this class, the checkpoint inhibitor. The first one being discovered for melanoma, and it's really revolutionized melanoma treatment in the way of much decreased side effects and much better outcomes. People are living much longer. These drugs have also been shown to be effective in lung, renal, lymphoma, urothelial, breast, gynae, head and neck, bladder, and liver. And so in Manitoba, we're able to give these 8 different drugs for 41 different indications. So although there's only these diseases listed here, there's different subsets of cancer or different types of tumor within each of these diseases. So it's really quite miraculous how well 8 drugs are able to treat 41 different types of cancer that would fall under these larger headings. So, side effects. Unfortunately, nothing, or I should say, everything comes with side effects. So, immunotherapy is very effective against many tumor and cancer types. It may be combined with chemotherapy or other targeted therapies. And we're seeing this more and more where people will actually have a chemotherapy combined with a immunotherapy. And then what happens is the chemotherapy portion may fall off after 6 or 8 treatments. And then the immunotherapy will stay on for, potentially 1 to 2 years. While toxicity is less common than the while toxicity is less common than with chemotherapy, people can still get side effects. These drugs can cause rare and unique side effects that can be very serious if not treated appropriately. So, as I said, it's a different kind of tea party. So, unlike sipping it out of the cups, it has to do with our T cells. And our T cells are a type of white blood cell that is responsible for attacking foreign substances in our body, viruses, cancer, etc. The side effects actually occur when our ramped up T cells, our immune system, attack our healthy cells. And so, unfortunately, they at some point are unable to discern the difference between a cancer cell as well as our healthy tissues. So these can happen at any time during treatment or sometimes even after stopping treatment. So here's just a picture that shows you that it can actually attack any bit of our body in here. And what it does is it will cause an inflammation of that tissue, sort of known as an itis. Okay. And so here's just a picture showing that it can go to all the different places. But remember, for the most part, the symptoms are mild, as well as, although they do occur, they are less common than, say, chemotherapy side effects. So we have a role together in regards to managing these immune related side effects. And it's a multidisciplinary team approach. That means it's your doctors, it's your nurses, it's yourselves. You guys need to play an active role in your treatment. So we have a baseline assessment. We have patient and family education. So the nurses will be able to go through the different information in regards to the medications that you are having, as well as who to call if you're having issues and different things to look out for. This education, although it may come initially from right at the beginning, please, it can be very confusing and very complicated. Please do not hesitate to ask questions. It doesn't matter if it's your second, third, 10th, 20th session. The information is always needs to be repeated so it can sink in. Different questions will pop up and as you go along. So, as health professionals, we know which side effects are you are more likely to experience. Which of those itises, which of those different systems will be potentially attacked. We're able to work on early detection and diagnosis, and that's why you have to come to the cancer center so often. And we're able to help you with treatment and management of those side effects. So the most common immune related side effects would be the skin. So here's my little picture of the skin, and that could be a rash or itching. So the colon, so you get an inflammation of the colon, and that could be evidenced by diarrhea. Liver. So here's my little happy liver here. And so transaminitis, that's a big fancy name. That just means that the liver is getting a little bit inflamed and some of our liver markers are becoming elevated. So endocrine, so that's our thyroid. So here's our thyroid gland here. We monitor this closely to make sure that people aren't having a low thyroid or a high thyroid, as well as our lungs. So a pneumonitis is an inflammation of the lungs. So here's my little lungs here. And again, we monitor patients for shortness of breath. We do scans to see if any of these things are occurring. So, what do you need to know? What is your responsibility? So, your responsibility is really to keep track of how you feel, what is going on, and you need to report any changes to your cancer team. Some people find that using a diary might be helpful. The other thing, when you have a shower in the morning, just have a look over yourself. Do you have any new rashes? Is anything new going on? Most people will have a shower, myself included, this morning, and you don't even pay any attention because it's so routine. So, is there anything new that's popped up on my skin? Am I having more diarrhea than usual? It's very important that you know the name of the medication that you are receiving. You need to know that this medication is an immunotherapy or checkpoint inhibitor. And so, why these are so important is I'm not sure if everyone realizes, but unfortunately, all the computers in Manitoba do not speak with one another. So, if you end up going to a hospital or to a different doctor or to a specialist and they say, what medications are you taking? They will not be able to access everything you're taking at CancerCare Manitoba. So it's really important that people keep a list in their purse, their wallet, on themselves of a list of all the medications they're taking, including their cancer treatments and their at home pills. For example, your blood pressure medications or your heart pills, etc. Okay. And what we want to be able to do is we want to be able to tell if we ever do have to go to emergency room to tell the ED, so that's emergency department physician, to please contact the oncologist as there is special treatments that may be required for side effects. Okay, because it's different than sort of the normal side effects that come with chemotherapy. So, detecting and managing adverse effects. So, it's the responsibility of your cancer team. You will have a physical examination. So, the medical oncologists or the designate will assess you for any possible immune related adverse side effects throughout your treatment and follow up. You'll have routine laboratory tests as well as different scans to mark your treatment and your progress as to how it's going. You have a blood test and a meeting with the oncologist or your family practitioner in oncology or your nurse practitioner prior to every cycle so they can assess your treatment. Here's some resources as well that I just wanted to show you. So here, everyone should have been given a medical alert. So this is a card that it's just both sides I've put up here. So the nurse will have gone through this with you. The point of the card is to be able to show this if you see any other healthcare providers, especially in an emergency room, that is saying that please contact your oncologist or your hematologist because there are some rare side effects that can be happening and they want to be notified to give appropriate advice. This is another information sheet just about immunotherapy that your nurse could give out to you. Other reliable resources. So we don't want people doing Mr. Google. It's not always helpful and it's not always effective. But these are some resources that are credible if people want to look into it a little bit more. So this is a Canadian Cancer Society, and you can just type in immunotherapy. The National Cancer Institute, it's American, but it's got a lot of really good, reliable information. The American Cancer Society and Cancer Research UK. So, treatment of immune related side effects. So, the most common thing that would happen is you'll be asked to take a break from your treatment and to let the symptoms resolve. We know from clinical trials that even with taking a break, often the immune treatment keeps working. As I had mentioned earlier, it causes an inflammation which is basically your immune system decreasing healthy tissue. We know that steroids, so that would be something like prednisone, methylprednisone, dexamethasone, helps decrease the immune system from attacking. So that is why you would be given steroids. You might also be given some supportive care. So, if you have an inflammation of your bowel and you have lots of diarrhea, they can give you some anti diarrhea medication. They also may prescribe different thyroid medication. If your thyroid's working too much or working too little, then they could use that. If people are very unwell, then they may require hospitalization for more intense supportive care. Conclusion. So I have two pages of conclusions. So immunotherapy has offered new lines of treatment and cure for patients that have not responded to traditional chemotherapy. The improved ability for scientists to examine cancer cells, genetic makeup of a cancer, to examine cancer cells and the genetic makeup of a cancer is leading to rapid and expanding new treatment options. I don't want to age myself, but I've been a cancer nurse for 28 years. I know, hard to believe. And initially, when I started, there was a handful of cancer treatments. Today, it's exploding. Every time I turn around, there's new drugs being invented. Unfortunately, although immunotherapy is one of the new kids on the block and offering promises for people that didn't respond previously to chemotherapy, it is not the magic cure for cancer because we know that not all patients will respond. It's also extremely expensive. So, for my take home messages, immunotherapy is an exciting new type of treatment for many cancers. There's usually fewer side effects than chemotherapy, but side effects do occur and can be life threatening. It's very important that you report any changes to your cancer team, and patients and families need to always be aware of the names of their anti cancer treatments and keep a medication list in your purse or wallet.
Thank you, Jodi.
Thank you. Take care, everybody.
Bye now.